Robin Gill.
Good evening and thank you for joining us. As provinces slowly reopen across the country, the need for testing and contact tracing will be critical. Today, Prime Minister Justin Trudeau announced his government will fund provincial efforts to test people for COVID-19 and track the contacts of those who test positive. Federal contact tracers will have the capacity to make thousands of calls a day when provinces ask. Ottawa is also helping to procure swabs and other key testing materials that will be needed.
Taking strong, collaborative action to expand testing and contact tracing is important for both Canadians and businesses to have confidence that we're on the right foot. They need to know that we have a coordinated approach to gradually reopen that is rooted in science, evidence, and the ability to rapidly detect and control any future outbreaks.
Testing is still lagging in many provinces, especially those hit hardest by the virus. Ontario's testing is only at half of its daily capacity, despite a spike in case numbers. Today, that province reported 441 new cases and 28 more deaths, the highest daily increase in 2 weeks. What's more troubling, Ontario hasn't been able to account for the source of exposure for more than 2/3 of reported cases in the past month. Quebec remains the epicenter of Canada's outbreak, and the province has yet to achieve its testing goal. Today, 646 new cases and 65 new deaths were recorded. But Quebec is allowing some cultural activities to restart at the end of the month. Museums, libraries, and drive-in theaters will reopen May 29th. Quebec and Ontario have been getting help from the military for the past month. More than 1,700 troops are assisting in long-term care homes, hit hard by the pandemic. But the number of soldiers getting sick is also climbing, and fast. Soldiers aren't currently getting hazard pay, but as Abigail Bimman reports, that could change.
Most COVID-19 deaths in Canada have happened inside long-term care homes, and there's been a sharp spike in the number of cases acquired by the soldiers who have gone inside. 29 cases Friday, up from 5 last week. The Department of National Defence tells Global News the spike is in part due to a wait for formal confirmation of test results.
The forces must be transparent with the numbers.
Veteran and advocate Sylvain Chartrand has been tracking troops working in long-term care homes.
I've got information that the training was really rushed for the typical soldier, and that's concerning.
DND won't provide details on the 29 people who got sick, but says no one needed hospitalization. Chartrand is calling for soldiers to be protected from health concerns that may arise in the future. And right now, while they're on the front lines, he's pushing for danger pay. He has the support of opposition parties.
I am very confident they're going to reach the right decision on this. Yes, they could do it quicker.
As soon as our troops started to become infected with COVID-19, it was inherent upon the government to put in place the hazard pay and benefits. And so for them not to react and do that now is a failure.
Global News asked the Prime Minister why hazard pay is not yet in place.
These are discussions that are ongoing within the military.
While he wouldn't commit to anything, Friday afternoon, the Chief of the Defence Staff announced he's asked staff to pursue hazard pay for those inside long-term care homes and promised more information soon. The military is now waiting to see if provinces will extend their requests for help. Quebec's agreement lasts until June 12th, Ontario's just until Wednesday. That province tells Global News they're looking at all options. Abigail Bimman, Global News, Ottawa.
A vaccine using technology from Canada and China appears to be showing promising results in humans. A report published today in the Lancet Medical Journal shows some of the participants developed antibodies and T-cell responses against the virus a month after vaccination. 108 adults in Wuhan, China are taking part in the study. They were given a single dose of a weakened common cold virus called adenovirus. Most participants reported fever or fatigue, which is typical for vaccines, but there were no serious side effects. Further trials are needed to confirm if the vaccine will protect people from COVID-19. This is one of about a dozen COVID-19 vaccines in the early stages of testing.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.